Namaste, everybody. On behalf of the Hindu Temple Society of North America, Akshayam group, that's the Young Professionals group, I would like to welcome all of you to Learning Series 33. This is a continuation of the Learning Series organized by the Akshayam group. This team organizes cultural, volunteer-based, and educational events at the temple. Events include lecture demonstrations, cultural programs, conferences, etc. The temple leadership and staff mentor Akshayam members and provide a supportive network for the team to pursue its vision and interests. Today, we have a different topic, albeit a very important one, especially during the time of COVID-19. We're going to be talking about emotional health in the time of COVID-19. And we have an expert with us, Dr. Anitha Iyer, who's the director of the Behavioral Health Population Management Program at Mount Sinai Health System, and also associate professor at the Icahn School of Medicine at Mount Sinai. Prior to joining Mount Sinai, Dr. Iyer was the clinical officer and vice president of Crisis and Behavioral Health Technologies for Vibrant Emotional Health, which is a New York City-based not-for-profit organization. Here, she helped implement and run large-scale state-of-the-art behavioral health programs, including, most notably, NYC. Dr. Iyer also served as an advisor to the National Suicide Prevention Lifeline. She's a recognized leader in the innovative delivery of crisis services, frequent speaker at behavioral health and suicide prevention conferences across the nation, and has served as a subject matter expert for media engagement on matters pertaining to mental health and suicide prevention. She also serves on the board of directors of Saki for South Asian Women, a New York City-based organization that supports South Asian survivors of interpersonal and gender-based violence. She's multilingual and fluent in English, Tamil, and Hindi. Dr. Iyer is a licensed clinical psychologist and earned a PhD in clinical psychology from Columbia University Teachers College and a BA in biology from Barnard College. A very warm welcome to you, Dr. Iyer, on behalf of the Temple Society of North America, and also a very warm welcome to our audience on Facebook and YouTube. We start today's session with an interactive session, and for which I will say a special thank you for our youth members who have agreed to participate in a session with Dr. Iyer and offering to talk about their experiences during COVID-19. I would like to first introduce Thea Vinod. Thank you, Thea, for agreeing to participate in today's session. And we also have Alicia. Both of them are youth members with the Hindu Temple and have been participating in a lot of events prior. And today, too, we will see all the brightness in this interactive session with Dr. Iyer. With that, I turn it over to Dr. Iyer.
Thank you so much. I'm so honored to be here today to present to my community. It is a real full circle moment for me. I have grown up practically on the temple grounds, and the temple has been such a source of strength for me and my family in our process of adjusting to life in the US. And everything we have in terms of the community that we have built here is courtesy of the temple. And I particularly want to note that, through the temple community, I have been blessed to interact with and see professionals in our community navigate the professional world. And that has been a huge influence for me. In particular, the professional women in our community, starting with Dr. Mysuriker, and so many others who are successful and powerful in their fields while remaining engaged and involved members of our community. That has been a huge influence for me. And this moment, being here today to talk about the work that I'm doing and the work that others in mental health care are doing to people in our community is really a very personal moment for me. So I'm deeply grateful for the opportunity. I want to turn for a moment to the two youngsters who are with us today. Really incredibly brave of the two of you to take a few moments to share with us what you have experienced as a result of all of the major changes that have come about since COVID. So why don't we start first with Thea? Ika, if you want to tell us in a few words, what you've been experiencing and what this process has been like for you, that would be great, and we can get started.
Hi, my name is Thea Vinod. I'm 13 years old, and I'm a 7th grader at Hunter College High School. COVID-19 impacted my life in ways that I couldn't have predicted, but in persisting through quarantine, I learned a lot. It all started around early March, and I noticed a lot of small things among my friends. More and more people around me started wearing masks, and people stopped stepping out for lunch. Around then, I heard about a recent virus outbreak that originated in China, and I wasn't too concerned about catching the virus. Only a handful of people in the US had it, and no one in New York had it at that point. Suddenly, 2 weeks later, more and more people were becoming scared of catching the virus, and a lot of kids started staying home from school to avoid catching it. I still wasn't too concerned because New York hadn't been too badly affected yet, but I started slowly adjusting to this new lifestyle by wearing a mask in the subway and coming home and taking a shower before doing anything else at home. And then just as I was beginning to adjust, school closures were announced. And it was kind of jarring, really, because it told me that what was happening was really real. And I was really confused and scared because everything that was happening was so uncertain at the time. The media was saying that cases were blowing up everywhere and the virus was getting worse and worse. And other parts of the media were saying that it was being highly exaggerated. So instead of focusing on what the media was saying, I just decided to not think about that and just focus on following social distancing rules. School itself stopped getting motivating once it was switched online. There was no interaction between friends, no friendly competition, and when even tests were canceled, there was no motivation at all to study. I realized that next year I'd have to know this year's course material, so I had to really push myself to be more attentive, but it wasn't easy. Other than school, there was not much to do. Occasionally, I'd bake or cook something, but obviously I couldn't do that every day, so it was a lot of just sitting around and doing nothing. It could have had adverse effects on my health, which I wasn't stopping to consider, but my mom had been thinking about that, and she started forcing me to do yoga. I was kind of lazy and didn't want to put any effort into it, but once I really started to put effort into it, it helped me a lot. It really focused me and calmed me down, and yoga was an important part of coping to the entire situation with quarantine. Other than that, I had so much extra time from not having to commute that I started to focus more and more on my extracurricular activities. With all the time I was putting into practicing them, I could see so much growth in myself that I was proud of using my time in a productive way. At the same time, even with having stuff to do, it was really frustrating staying in the same scenery all the time. It became really monotonous just to wake up and see the same room, same house every single day and not go anywhere at all. And it became even claustrophobic at times. But the alternative was to be outside, and outside was so scary and uncertain. I was really just grateful to be safe in my own home. I knew there were people who were having a harder time keeping themselves safe. And I was also so grateful for all the essential workers who were working hard and putting their own health on the line to keep us safe. I actually attended a car parade with my elementary school community to thank all the essential workers, like doctors and nurses, at a local hospital. And it was a touching and eye-opening experience because this large community gathered together and showed appreciation for people who deserved it, and still do. All in all, my experience with COVID-19 was really difficult and frustrating at times, but I learned a lot in the process. I learned how to adapt to situations. I learned how to make better use of my time. I learned to be grateful for what I have. And most importantly, I learned that community is there for each other in times of need and appreciate each other in times of need. Thank you for letting me share my experience with COVID-19. Namaste.
Thank you so much, Thea. I'm so struck with sort of how beautifully you articulated what has been for all of us a really complex time. And it sounds like it's been a pretty complex time for you as well. And I really applaud you for sharing that with us so that kids your age who are listening, as well as maybe some adults who are listening, are maybe able to borrow some of your words. You talked about how it was jarring at first, confusing, fearful, right? And mixed information and information sort of changing day by day, including in the news media, and not really sure if what's happening is real. That's a very important sort of way to articulate that, because it was like that. We sort of were getting different pieces of information on a daily basis, and it's hard to keep track of all of that. You also noted that school was less motivating, particularly with the shift to online learning, and tests are now canceled and such. And that's very real, and the goalpost sort of shifts. We have to readjust, and I can imagine how hard that was for you. I'm glad that you found ways to push yourself. I'm glad that you were able to allow your mom to force you to do yoga. I'm glad that that was helpful. Really appreciate you underscoring for us the value of adapting and finding ways to look for things that we are grateful for, including community. So thank you. I really appreciate your honesty and your bravery to share with us. I want to switch to you, Alicia. Thank you again for being brave enough to share with us here today. Do you want to tell us, in a bit, sort of what you've experienced?
Yes, thank you. Hi, my name is Alicia Vora, and I'm a 7th grader at Middle School 67, and I'm 12 years old. COVID-19 has taken a toll on me, both mentally and physically. It was a big and new change, and like nothing I've ever experienced before. Everyone is facing the same and different external and internal issues. I've learned and had to learn that the positives are always greater than the negatives in every situation, and to take out the positives rather than be absorbed in the negatives in any situation. Above all, I've learned how to reflect, to understand, and in turn develop and adapt, which outweighed all the cons. For example, one of the issues with COVID-19 that has been hard for me to cope with was a lack of motivation and unproductivity. I was always constantly surrounded by too many distractions, and it was very easy to fall out of the cycle of productivity with not as many work limitations and set routines. I felt aimless at times and distant from myself, which came with a sense of boredom, despite me having many hobbies that I could have done. Additionally, it has come with difficulties in isolating myself. I was absorbed by my thoughts and mind constantly because I had less opportunities to be regularly social and less responsibilities. This made me overthink and second-guess myself frequently. Another internal struggle I faced has been handling remote learning. It was mentally difficult, and I felt like I wasn't learning anything. It became so much less motivating and fulfilling, and it became such a burden and annoying to me, which came as a shock to me because I normally love school. All of these turned into a learning experience. To fix these bad habits, I had to reflect on myself and how I've reacted to the situation and the areas I wasn't in touch with, and this made me able to take the initiative to make better and set better mental and physical habits and put more thought on myself. Another example of an issue I faced in this hard time is being surrounded by my family constantly. It could get annoying at times, I'm not going to lie. And being with them every second of every day constantly caused clashing and arguing, which made me feel very guilty. However, the positives of this was that it brought more understanding between us, it strengthened my relationship with them, and it brought more quality and cherishable time between us. It made me more grateful for them and that I have them and for all they do, especially in this scary time when so many people are losing their loved ones. Overall, and most prominently, I lost my way of life, and everything was different. Life without school, direct social interactions, going outside, basic routines, and what I call normal has been very difficult to cope with. Having to change and mold because of the situation made me feel sad and frustrated at times like I had nothing. However, this turned into me putting things in perspective and looking at it all from an overall standpoint. I have it so much better than in this situation than so many others do. People that are less fortunate than I am are losing resources and avenues. Essential workers are risking their lives for ours and to supply and protect us and keep us safe. So many people are getting unemployed and losing money, and people are getting sick and losing their lives and their loved ones. Ultimately, I had to come to understand that no one asked for this, and we are all suffering, and my problems are minimal compared to what others have had to go through. I've learned to make the most out of this situation and be thankful and appreciative for the life I am living. I learned how to adapt to big change and have a growth mindset in situations that may seem hopeless, which is very beneficial for the future because I've never gone through such a huge change, and I don't know what the future holds at this point. In the end, with all the uncertainty and confusion and hardship within myself and the world, I've gained so much. Awareness, mindfulness, compassion, strength, understanding, and so much more. Thank you.
Thank you so much, Alicia. Again, I'm so impressed with both of your guys' ability to articulate what you're feeling. I don't think I could have done that when I was your age, for sure. And everything you noted, Alicia, particularly I was really drawn to when you talk about awareness, because there really is value in taking these moments as opportunities to pause and reflect and learn. You talked about that growth mindset, which there's perhaps those are the silver linings that we can grasp at, but I don't want to undermine, the heaviness of what you experienced. Like Thea, you talked about, the lack of motivation, the unproductivity, the distractions, the shift to remote learning, and having to do everything now with a completely different mode with all these distractions at your fingertips. It's a lot. It's really hard. It's not easy to master all those things and continue and go on day after day. The disruptions to routine, the loss of way of life. I think you captured that really well. So I'm grateful to you for providing us those words. I want to thank you both again. I think you are leading by example, really, showing members of our community who are watching today that it's okay to talk about things being difficult and having emotional demands as a result of the really unique situation that we find ourselves in. So thank you both. I want to use what you said to sort of segue into my talk, into talking about emotional health in the time of COVID. So bear with me for a moment while I just put my slides on. Srividya, if you could just, before I proceed any further, if you could just chime in and confirm that you're able to see the slides and you're able to hear me.
Yes, sir. I can see the slides and we can hear you clearly. I would just mention for the audience, if you have any questions, you can post it on Facebook and we'll take it at the end of the presentation if time permits. Thank you.
Thank you. So, we just heard from Thea and Alicia, really two brave kids who are showing us that not only has COVID had an emotional impact, as you would expect it to, but the emotional impact that comes with disaster situations or this kind of really unique, unprecedented sort of mass pandemic global event that we're in the midst of, that the impact isn't always in the ways that you would expect, right? They're sort of hidden, intangible, if you will, ways that our emotional changes and disruptions can manifest themselves. Both kids talked about not being motivated, feeling scared, feeling confused, feeling less productive than they usually are. And I'm sure that, as we all reflect, these are things that we have experienced and struggled with over the last 3+ months or so. I know I certainly have. There have been days that have been really difficult, and you really have to dig deep to show up, if you will. So I want to talk to all of you today about sort of some of these symptoms and some of the things that are ways in which our body tells us that we're experiencing emotional distress. I want to talk a little bit about how to identify that, how to help each other, and what are some resources in the community. And I also want to emphasize what some of the factors that influence those stresses are. So in my talk today, I'll provide a little bit of the context for COVID and why it is an emotional stressor. We'll go through a bit around the reactions to COVID that are reasonable to expect, some strategies we can use to take care of ourselves and other people. We'll talk a little bit about unique challenges that different groups of people experience, and then I'll leave you with some resources that are free and available to the community that you may want to take advantage of. And as Srividya mentioned, please send in your questions through Facebook, and I'm happy to answer any and all questions that you have. So their emotional reactions to COVID range. They vary, and they come about due to a variety of stressors. Before I go any further, I want to note that we all have emotional reactions, whether we express them, whether we confirm them to ourselves and to people in our lives or not. We're human beings, and therefore we feel emotions. So having emotional reactions that are uncomfortable is okay. And it's okay to talk about it in much the same ways that we would feel comfortable talking about, having diabetes or having chest pains or having headaches. When we have symptoms of any medical condition, we tend not to hide them. We tend to talk about them openly. We tend not to hesitate to go seek care for it. Whereas emotional reactions, particularly in our community, there's a good amount of stigma around it. So my hope is that in the process of talking today, we can help break some of that stigma down. In looking to what are emotional reactions to COVID in particular, the field has really relied on disaster psychiatry, or work in the aftermath of disasters, right? So after any sort of infectious disease outbreak or a mass disaster event, if you will, something that impacts not just one person, but a community, it's very normal to experience fear and worry about one's own health or the health of loved ones. Those of us who were in the US during the H1N1 outbreak or the Ebola outbreak, probably recall worries about, is it okay to take the subway? Is it, when's the vaccine available? And so on and so forth. So those sorts of fears and worries are very natural. We can also experience changes in our sleeping and our eating patterns. These are often the ways in which our body starts to signal to us that things are sort of shifting and we're not really experiencing ourselves at our emotional baseline. We also start to have difficulty concentrating. Our mind wanders, we tend to be preoccupied, we might overthink. We may, if we already have chronic health problems, we may experiencing a worsening of those symptoms. And if we have underlying mental health conditions, we may experience a worsening of that. So if you're already experiencing some depression, you may feel it worse. If you're already an anxious person, you may feel more anxious as a result of an infectious disease outbreak. And if there are folks who are using substances, alcohol included, to sort of soothe themselves, if you will, you may find that you've been using more, you've been drinking more, you've been sort of seeking other drugs or abusing medications more. These are all telltale signs that our body is responding and we are experiencing emotional distress. And this would happen under any sort of situation of duress. But there are some really unique additional stressors due to COVID, which are really important to underscore and emphasize. So I mentioned depression, the symptoms of sleeping or difficulty concentrating. These are in fact, underlying symptoms of depression. That can worsen when you experience the kind of disruption to our social connections that the social distancing guidelines sort of precipitate, right? So if we rely on our social connections to sort of pull ourselves out of depressive funks, you now are in a period of time where we are expected to stay away from our friends and our relatives, minimize contact, and that can increase an individual's isolation and worsen the depression that you may be experiencing. PTSD symptoms, which is really symptoms of heightened stress, avoidance of situations that make you worried, a sense of hypervigilance, difficulty sleeping, feeling very hyper aroused, overly anxious, physically anxious. Those sorts of symptoms tend to increase in situations of quarantine. And so we might expect ourselves to experience those things as well in the aftermath of COVID. Grief is a very important emotional reaction to underscore as well, particularly if you've experienced loss of loved ones. That is, there's a normal grieving process, which can take its emotional toll. And sometimes we struggle to remove ourselves from the grieving process and go through the stages of grief and loss sort of in a predictable manner. And we might find ourselves stuck in sort of one stage of grief and unable to really cope. And like I said, this can be particularly compounded for those of us who've lost someone we know or a relative or so on due to COVID. It's important to also note that we've also lost our routines. We've lost some of our familiar sort of the things that were part of our lives. The kids both talked about sort of the loss of a way of life, the shifting to new things and adapting. While we try to cope, the grief that we can experience from loss of the things that are familiar to us can be quite profound. I want to note also that there may be those in our community that additionally experience financial stress, right? So businesses have had to at least temporarily close. Folks have perhaps, been on the receiving end of job loss or have had to file unemployment with uncertainty about what awaits at the end of that process. Or there may be sort of the unemployment check perhaps doesn't cover all of the bills that you have on a routine basis. And then you worry about how long can I keep going? There may be those of us who have experienced salary cuts. A lot of companies have implemented that or have asked employees to work a reduced work weeks to make their bottom line a bit more feasible. And so those sorts of stressors really play a role in increasing duress. It should be noted that financial stress accounts for a significant amount of the stress that Americans in general have been reporting when the Pew Research Center or the American Psychological Association or the CDC has conducted mass surveys. People are reporting increased stress due to COVID and particularly noting high stress when there are financial concerns as well. Childcare issues are a huge stressor. So I mentioned the American Psychological Association survey. They found that 70% of American parents are experiencing heightened and really abnormal levels of stress. And it's understandable when you think about how many parents have had to essentially learn how to teach their children from home using media that they're really not familiar with. And so many other parents have to do that while also working full-time and learning how to adapt their work schedule to a new medium. So it's really a lot and it's creeping up. In fact, I found it very difficult to have to work full time while caring for my children, helping them through school, making sure they're completing their assignments and submitting them on time and so on. I've been talking to friends who are also parents of young kids, and it's quite common now to hear people say, wow, like if school continues to be at least partially virtual in September, I'm not sure that I'm ready for this again. So many people were sort of waiting for the summer break just to be able to alleviate some of that distress, and here it might be coming around again. So this is a significant area of stress. Guilt as well is a powerful emotion that may be at play right now, particularly if people feel like, I have relative advantages compared to other people. That can be a good thing. It can be something we're grateful for. We're grateful for the opportunities we have. We're grateful maybe to have access to healthcare and so on. But sometimes the flip side of it and being aware of that can also trigger intense feelings of guilt, which can be uncomfortable to sit with. We can also experience the other piece of it, right? There may be those of us that are really struggling financially or experiencing language barriers and worried about either direct impacts of those or indirectly worried that you might be discriminated based on those, or you may be experiencing discrimination. All of this is unfolding while the country is also grappling with our relationship as a society to race. And so, for those of us in the Indian community, it hits home. We've lived through 9/11. We have had racial backlash. So many of our elders in the community have experienced racial backlash in our own home, right, in India, particularly during sort of post-colonial period. And so all of that can sort of get packaged in, if you will, and really exacerbate the emotional reactions that we're feeling when confronted with health disparities that may be racially motivated or discrimination on top of the health disparities. So all of this is sort of a complex mess, if you will, which really contributes to heightened emotionality. I do also want to note particular stressors to those of us in our community that work in healthcare. Right, as we know, Indian Americans constitute a large section of healthcare providers. And healthcare providers are always at heightened risk for safety because they come in contact with pathogens and such. But there is heightened risk now to their safety, and they have to sort of put that aside and go back into the trenches, if you will. And then they worry about contracting the virus themselves or bringing it home to their family. Maybe they have elder parents that live with them, and that becomes sort of a source of stress. And then there's all of the effects that come with that. Those of our community members that are healthcare providers in the community, maybe primary care physicians and such out in the community in private practice, have had to adapt very rapidly to new treatment methods, to learning new guidelines. They're supporting their staff, they're absorbing their patient stresses. So it's a lot. And it's a very complex sort of set of experiences that we are in the midst of right now. So if you're experiencing strong reactions, it's okay. You're not alone. I wanted to talk a little bit about some strategies, some tried and tested approaches to manage that bad stress. And I call it bad stress, and I put it in quotes because not all stress is bad, right? Some stress is good. Sometimes stress is our body's way of motivating us into action to try to fix a problem, if you will, or to take care of a situation or to mitigate some sort of challenge, but only up to a certain amount, right? Beyond a certain amount of stress, it sort of goes into this inverted bell curve where you start to experience diminishing gains from it. And so it's really important if you're over that threshold to start managing your stress. Some of the things that you can do to manage your stress include attending to your basic needs. Really make sure you're eating. Make sure you're doing what you can to help yourself sleep. Make sure that you're taking care of yourself. Even something like sort of forcing yourself to get out of bed and take a shower and sort of get ready for the day can help you feel like, a bit more in control of yourself than otherwise. I recall when the pandemic first started, it felt somewhat temporary still, and it was unclear how long this would last. And so I found myself sometimes, like the 9 a.m. meetings, I would turn my video off and I would join it in my pajamas. And I found that wasn't really helping me, and it was making it difficult for me to separate work from home time, and it was adding to my stress. So attending to my basic needs first thing in the morning has been helpful in kind of creating some boundaries and managing stresses. Take breaks. Particularly if you're working from home, it might be helpful to try to step away from your desk. If you have a desk, to sort of go grab lunch so that you can segment your day to the extent possible and create opportunities for yourself to sort of decompress. Connect with your colleagues, communicate constructively with colleagues, and the same, connect and contact with your family. Talking about what we feel as anti-intuitive or sort of artificial as it might sometimes seem, particularly because we as a community don't really talk about our feelings, it can really help. It can go a long way because, one of the kids talked about, everyone is going through it. And so when we talk to others, we start to realize that, wow, I'm not the only one that's experiencing this. That can be very validating, and that can be the beginning of a process of acknowledging what you're experiencing and then trying to go about mitigating that. If someone doesn't want to talk, obviously respect their differences, but while talking to others may help you, sometimes making room for someone else to talk to you can help them, but it can also help ourselves, right? By helping others, we can sometimes create the space to really absorb what we might be feeling and really validate that for ourselves as well. This next one is really important, right? So stay updated with information, but limit your exposure to media. I've had to learn this the hard way as a news junkie, really learning to tell myself, at what point is breaking news just the same news, they're just repeating it over and over again. And so what am I gaining if I continue to watch the same news report on loop? And what am I losing? And I found that, I'm losing my peace of mind because I'm getting overwhelmed with the same information over and over again throughout the day. So learning to say, I'll absorb this information through this channel or this news report or this medium, and this much is enough. Beyond that, it's not really helping me. And so I'm going to shut my TV off or stop checking Twitter or whatever it may be. And then check in with yourself. Take the time to really step back and say, how am I feeling today? How am I doing? How am I sleeping? How am I eating? Am I taking care of myself? Am I managing my basic needs? So having spoken about sort of how COVID impacts us generally, I want to talk a little bit about specific subgroups within our community, because there are some unique challenges that are really important to highlight. The kids that spoke before me beautifully articulated the impact on children and adolescents, and the largest source of their stressor obviously has been, learning to navigate remote learning, and the impact that has on their parents as well. But I want to note the impact on couples. It's really an area that, again, we have a lot of cultural pressures to not talk about, right? We don't, our community really doesn't, historically create room for discussion of differences between couples and trouble in paradise, if you will. But couples are people and they are human. And so, coping in general is hard. Life is difficult. We're all pretty much living in the fast lane. But maintaining your coupledom in this time with all of these added stressors is really difficult. So it's important to underscore that and to call it out. We're all experiencing, including couples, disrupted routines. If you have one person working from home and the other person is going into the office, there may be sort of stresses that come with that. The person at home may worry about the person going into the office. The person at the office may worry about the person at home, sort of managing a heightened amount of responsibility. There may be altered responsibilities and divisions of labor, which are either, difficult or new that the couple has to tolerate. But there may also be those situations where, each person in the couple doesn't really understand the experience of the other person. And that might come across to the other person as though it's being dismissed or disregarded, even though that may not be the intention. So things can fester. And particularly when you have these situations where, there was a period of time when we were all at home, quarantined, there was no opening at all of any kind. And so if we're all at home all the time together, there can be those clashes that build up. It's sort of the opposite of absence makes the heart grow fonder. And so it's really important to really attend to this intentively and understand that, you can't just expect it to fix itself. So I found this quote, which I found really helpful in thinking about how to work through it as a couple. And the psychologist who mentioned it talked about water what you want to grow, right? So when you step back as a couple and you look at what is festering in your home as a result of COVID and all the time together and all the altered responsibilities and divisions, it might be helpful to not focus on what's different and what the problems are, but to instead focus on the things that make you work as a couple, the things that brought you together, the things that you like about each other. It might be as simple as just giving a nod to that. Hey, I really like, when you do this. I really like when you make tea. I enjoy the tea you make, or I really like that you help the kids with homework. Whatever it may be, those little compliments that help you grow the things that work, and communicate, continue to communicate. Don't assume that your partner knows what it is that's distressing you. Even if you've been together for many years, we are in unprecedented times and your partner may be coping very differently than you're used to them coping. I wanted to talk a little bit about impact on children. Particularly, this is directed a lot at parents who may be listening. There are some telltale changes that you might sort of attend to that might help you figure out what it is that your child is experiencing and perhaps struggling to articulate, right? The two children that spoke today are very articulate. Perhaps not all children are that articulate and may struggle to really put words to what they experience. And in fact, really young children, this could really go on for them because they may not have the vocabulary yet to really put their emotions into words. So from a behavioral standpoint, you can expect that you might see changes in how the child eats or sleeps, or you might start to see that they're acting out, pushing back, talking back to you more than they used to, skirting the rules, pushing boundaries. These are all things, if they are a departure from your child's norm, they are important to attend to. Emotionally, the child may experience what they're going through by crying. They might express worry. They might express sadness. And so that's something to attend to. Difficulty concentrating, I mentioned this with adults. It happens with children as well. So you might see that with their schoolwork. And then they might start performing poorly in school. Now, it's important to be able to separate, departures from baseline, but also put it in the context of remote learning, because remote learning inherently makes it difficult for children to concentrate. And it's hard for children to maintain their school performance while they are in this new medium. So what should you do if you observe these things? Should you force your child to sort of try to focus more, or, push them harder to do better in school? Probably not, right? That's going to just perhaps worsen the situation. Instead, what you can do is talk to your child, right? Tell them what it is that you're observing. I noticed that you've had a really hard time getting your schoolwork done. You want to talk about that? Because that's not like you. What's going on, right? When you observe it for them, you're now allowing them to feel very validated. And then you might open the door to a conversation where the child can say, wow, yeah, I have had difficulty concentrating. And they might tell you, is it because of remote learning or because they're not able to sleep at night? They're so worried. So that opens the door to larger conversations, which then allow you to answer questions. If they have questions about COVID, answer them and reassure them. Be honest, right? If you're scared, it's okay to tell your child that. It's okay to say, I don't know. This is a scary time. I understand why you would be scared. I'm sometimes scared, but I'm here for you, and I'll always be here for you. Here are the things we know. We know that if you wear your mask in public and you wash your hands, that's going to help. And so I'll always do that and will always do that. So those sorts of conversations allow you to honestly reflect back to your child, again, validating their experience while reassuring them that things will be okay. Limiting news media, I mentioned this for everybody, and that's no less important for kids. I have two children. My younger child told me once that she's afraid of breaking news. And what she meant by that when I asked her was that the ticker on the bottom of the news channel is constantly flashing really, sensationalized, scary headlines. And she's 6.5 years old, but can read. And so was making all the drawing conclusions and really making interpretations for herself in a way that can be too scary. So my takeaway from that was to shut the TV off or put it on some more benign channel so that there aren't sort of sources of stress for my child that I'm not even aware of would be stressful. Trying to enforce routines is really important. And spoken as a parent, be kind to yourself as a parent if you're struggling to do this. I am struggling to do it. And it's okay. It's tough. There's a lot going on. There are a lot of pressures. But do your best to the extent that you can to enforce routines, whether it's a bedtime routine or a routine for a time they must wake up in the morning, breakfast, lunch, dinner routines, whatever it may be. You might be wanting to set some boundaries around electronic usage because we know that that is really increasing and that can be a huge source of stress for children, and it can then further disrupt their routines. So do what you can to enforce the routines that you can reasonably maintain without creating undue stress for yourself as a parent. And then this one, quote from Gandhi, which I cherish and is so important in this time, is be the change you want to see, right? So I picked this image of putting the oxygen mask on yourself first because our children primarily learn from us by watching what it is that we do. So if they see you doing yoga as Thea mentioned, her mom sort of made her do yoga, that helps them follow along in a way that is much more impactful than if you simply tell them to do something that, wake up on time, take care of yourself, take care of your basic needs, but you're not really demonstrating that in your own actions. So again, be the change you want to see. I want to talk briefly about the impact on older adults. I want to note here that our community as it stands today really owes a huge debt of gratitude to those in our community that immigrated to the United States in the 70s and the 80s and the 90s and really set up the space and created this world that we come to rely so much on. And that group, whether they're in their 60s, 70s, and 80s, really are the group that, may be feeling the most heightened amount of anxiety at this time, because they may have a fear of being, quote, high risk, if you will, and fear of losses. There may be underlying and sort of active worries about their friends who are also in the same age group, who have now become their family, home away from home, if you will. And so it's really incumbent upon us to look after and look out for the older adults in our community. Because they're facing disrupted social connections, right? The temple itself is such a huge source of social connection through pujas and weekly events and such. Those have been disrupted. I know that my parents, for example, have really found it to be valuable to have Zoom broadcasts or YouTube broadcasts of pujas at the temple and such, because it provides an opportunity to feel like there are connections or those are maintained. But there may be still sort of a sense of isolation from not being able to go into the temple and have the big events that we are all used to. So that's a source of stress that is important to attend to. And, it's important to not assume that the older adults among us are all comfortable with the technological platforms, including FaceTime. It may be really, I struggle sometimes with social platforms that my kids are better at. So important to sort of check in and not just say, hey, talk to me via FaceTime, but do you know how to use it and can I help you set it up? And then our older adults may have real difficulty right now maintaining their preventive care, although things are opening up now. With this resurgence in other states, we're still in a bit of a tenuous situation. So ensuring that they're able to get to their primary care and maintain those sort of access points is really important. So regularly check in, call, video chat, help them set up video chat first, if that would be an essential piece of this. And then ask very specifically about routine disruptions and other worries. Don't wait for them to tell you, because again, there may be a generational piece here where, they don't necessarily think about emotions with the same vocabulary that others might. So ask very specifically, how has it been for you that you're not able to go into the temple and meet your friends regularly? Has that been hard? Ask about food, grocery needs, and errands. Offer to bring grocery, offer to pick it up and drop off, and so on. And then really seek their advice, wisdom, and perspective, and offer gratitude. There's a lot of value in that for us as adults in the community, as well as the young adults and the kids. But there's also a lot of value in that for older adults, because it might allow them to sort of feel like, there are important things that they have learned through their experience and all of the sort of plethora of knowledge that they've gathered, and sharing that can be very meaningful. So take that opportunity. I've included here some links, which we can perhaps post later to Facebook, which might be some sources of easy information that you can use if you have an older adult in your life that you're worried about. I wanted to also share some community resources. So the New York State Office of Mental Health has set up an emotional support hotline, which I've included the website as well as the toll-free phone number. It's available 24/7. NYC Well, which is a city-run service that is available by phone, text, as well as web chat. The National Domestic Violence Hotline is an important one. And on this note, I just want to mention, I talked earlier about couples and the impact on couples. Violence in a home is never okay. And a couple is not functional if they use violence to communicate with each other. That's not communication, that's abuse. And so if anybody on this call is experiencing violence in the home, you don't have to put up with it. There are resources that you can seek out, including Sakhi for South Asian women as well. And then I also wanted to share the COVID Coach app, which the U.S. Department of Veterans Affairs has developed, and they have made it available to the public for free. It's a really excellent app. I've tried it out myself. It's easy to use and navigate. It has informational pages as well as sort of breathing exercises and such that you can sort of go through in a self-guided manner. And then if you are taking away from this talk today that you are experiencing emotional distress and that it is a departure from your baseline, you can seek help. It's okay to seek help and seek mental health care, just like you wouldn't hesitate to seek medical resources and medical care for diabetes or heart issues or, a common cold or a headache. You don't have to be ashamed if you're feeling depressed or anxious or unable to sleep or, unmotivated and just really feeling like you are out of sorts. You can seek help. And Psychology Today is a website where you can find providers of all stripes, mental health providers in the New York area. It's also available for other parts of the US. And you can sort of filter and search by certain preferences and such. You might even find folks that have your insurance and so on. So I hope that those who are listening who feel like, it may be time to seek mental health care, really step on that now, and help is available. You don't have to go through this alone. That said, I'll stop here. I want to make sure that there's time for questions. So I will exit my slide and I'm happy to take.
Thank you, Dr. Iyer. That was a very good presentation and hopefully very helpful for our viewers too. We do have some questions for you. The first one, it gets to the concept of destigmatizing the topic. So we would take this one first. It's how do we convince our loved ones that their emotional health is important if they're not used to traditionally discussing these topics, which is most of the times the case in communities like ours?
Yeah, it's such a good question. The first step is talking to them. I always find it helpful to sort of say kind of some of what I was telling you just now about, when your chest hurts, you don't tell yourself feel better, go to sleep and make it feel better. If you have a fever, you don't say to yourself, oh, it'll be fine, just be a little stronger, you'll be better, right? We don't do that to ourselves. We take it seriously, we go to the doctor. Sometimes equating it in that way is helpful. It might help your loved one. It might help you put it in terms that they can sort of absorb, and they're used to sort of thinking about it. So that might be a way to do it. And then, I always find it really helpful to also put it in personal terms. It doesn't sound preachy. You might say, I know I have some really tough days. I know I have days when I have a hard time getting out of bed. And so I feel depressed. I feel like unmotivated, and I find it helpful when I talk to someone about it. It makes me feel better. And it helps me move on with my life and continue to be a productive citizen of society. Why don't you try that? That kind of approach may help. It sometimes also helps to go with a person to their therapy appointment. It might help them sort of feel eased into it. You can wait in the waiting room while they're talking to the therapist. And then sort of that might help them feel like two worlds are getting bridged a bit more.
Thank you, Anitha. That was a very convincing answer. Now, actually, coming to the younger generation, there we do have a question regarding, a child, like if they don't seem like, as normal or doesn't seem upset, but the behavior seems to be out of place, acting out more or eating in different sleep patterns. Is that something a parent should be worried about? And if yes, how can the child be helped?
Yeah. We have incredible instincts as parents in terms of what our child is, perhaps feeling but not communicating. And so I think it's really important for parents to listen to your instinct, right? So even if your child says, no, I'm fine, don't bother me, get out of my room, whatever it is that they may say, particularly adolescents, right? And high schoolers, where they're also in a phase of life where they really want privacy. So even if your child is telling you they're fine, but you can tell as a parent, something is off. I'm worried about you. I don't know what it is, but trust your instinct. Ask them, right? And again, in the same way that I just described for family members at large, humbling yourself and sort of telling your child that you have hard days makes it okay for your child to acknowledge that to you. There's a lot of power in that kind of peer connection. Like, you and I are not different. I know what you're feeling, kind of thing. So if you are worried about your child's acting out behavior, if your child's behavior seems different from the norm, trust your instinct, and ask, what's the harm that will come out of that, right? At most, they'll say nothing is wrong. Just leave me alone. I'm totally fine. Well, at least you asked, and you can ask again a few weeks later if it persists and continues. And as I mentioned when I was sharing the slides, sometimes it helps to point out to the child specific things that you're observing that are causing you concern.
Okay, thank you. And actually, there is a very important question, and this is, I think, goes to the population or patients who already have existing depression. So when you have a person like that within your family who's already depressed at baseline, if they're a concern or worry that they might be experiencing suicidal tendencies, and what is, but the person is afraid to ask because we don't want to be providing an trigger for that. But is that a cause for concern? And if yes, how can the family member help out the person? And is there anything different to be done with people who have baseline depression or other psychiatric disorders?
Yeah, it's a really good question. I'm glad it came up. I didn't talk very specifically about suicidality, but intense emotional distress can come with the thoughts of wanting to kill yourself. And that's distressing for the person. And it's also distressing for their family members because they might feel sort of ill-equipped to be able to support and help their family member. And there's this myth as well that if you ask somebody, are you having thoughts of suicide, you somehow put the thought in their head. It wasn't there before, but now that you've asked it, you've now suggested it to them. When in fact, research shows us that that's not how it works. If someone is having thoughts of suicide and you ask them, quite often when people feel really intensely depressed, they can feel so depressed that they don't want to live anymore. Are you experiencing those thoughts? When we ask that, it's not that you put the thought in their head. It's actually the exact opposite. You've now given them permission to talk about those thoughts, and you've opened the door for a conversation which they otherwise may not have been comfortable sharing, right? They might have hesitated. They might have decided it's too scary or too embarrassing, or they don't want to worry their family, and they keep it to themselves. But when you open the door to that, especially if it's a family member who has underlying depression and you're already worried about them and you're worried that, their feelings may become exacerbated, asking about it and then saying, are you having thoughts of suicide? Okay, what do you think you want to do? Like, have you thought about how you would do this? And then making sure they're safe. Like, if they tell you these are the things I'm thinking about doing, make sure those means are away. Don't make sure they don't have access to those objects, and then talk very firmly and clearly with them about seeking help. Suicide is preventable, right? Just a statistic on that is that for every person who dies by suicide in the US, 280 people seriously contemplate suicide but don't go through with it. That's an incredibly powerful statistic, right? Because that means that if we intervene at the right time, we can prevent it. And so my big point that I want to underscore for family members that are concerned about anyone with suicidality is, don't be afraid to broach the topic. Openly ask it. Don't ask if they want to hurt themselves. Ask if they want to kill themselves. Tell them that you are there for them. Make sure they are safe. Take those means away, and then connect them to care. And make sure that you stay with them, you hold their hand, and you let them know that they are not alone. There's incredible stories from suicide attempt survivors who are now here to tell us that they're glad they didn't go through with it. So family can be powerful in suicide prevention.
Thank you, Iyer. And a very well said point. I mean, prevention is very important here, and better safe than sorry plays here much more than anywhere else. Now, an aspect of technology, since you did bring in family members helping them, and given the lockdown, no virtual contact, like innovative technological solutions, have they been used for supporting emotional health, or has telehealth been leveraged? And something for our audience too, to know where they could go from their home.
Right. Yeah. Yeah. It's just a really important question. Technology, we're probably at a point in our history where we are both completely dependent on it in some ways, but in other ways we also try to sort of acknowledge how much it overwhelms us, right? But when it comes to mental health, technology is a huge resource for opening points of access, right? So some members of our community may not be able to get to a doctor's appointment for mental health care. They may want to, but they may not be able to, or maybe they're afraid to get in an Uber right now with COVID and go to visit the doctor, right? Or maybe they are afraid, maybe they're afraid of falls or so on. And so it's a question of I want to, but I don't know how to get there. For others, it may be that they want to get care, but they don't want anyone to know about it. Right? They don't want family members to know that they are going to mental health care. They don't want to be seen going into a mental health provider's office. There are numerous reasons why access is difficult, and technology can help bridge that access point, right? So there are services that are available for free by phone, text, and chat. I mentioned NYC Well or in one of the slides. That's an important service because it's available all the time, and you can do it from the privacy and the comfort of your home at any hour of the night, right? So if the only time that you can speak to somebody about what you're experiencing is after your children have gone to bed, there are counselors at NYC Well that are available to talk to you. And, for those of our community that are watching this from other parts of the US, there are hotline services available all around the country that are similar, that have phone, text, and chat platforms. And you can find them by searching your local Department of Health website. There, in fact, are similar hotline services now in India as well, in every state pretty much. Those mediums are very helpful. There are also apps, like I mentioned, the COVID Coach app is really helpful. There are some other sort of apps that walk you through guided meditation and such. Headspace is a pretty popular app these days, as well as Calm, both of which sort of promote meditative practices. So I'm a huge advocate for utilizing technologies to connect people to care.
Thank you, Dr. Iyer. I think we are up on time now, but if there are additional questions, we will post your contact info, as well as this presentation today will be available on Facebook and YouTube. And thank you again for your time. I think it's a very important topic for people to listen about, for both for helping themselves and others, and to know there is professional support here. In addition, I would like to thank both Thea and Alicia again for participating in the session, and all the organizers who helped us put this event together. And our audience on Facebook and YouTube, as always, thank you for all your support. Akshayam group will be continuing their series, the learning series. So please visit the temple website for more details, and you'll also receive notifications. Thank you, everybody.